In that building is Scott Gottlieb, the director of the Food and Drug Administration. Dr. Gottlieb has the ability to put an end to contingent electric shock, a goal of disability rights advocates now for over 30 years. Unfortunately, for the last several years, the regulations to ban contingent electric shock, the use of pain for behavior modification through electric shocks of children and adults with disabilities, have been sitting on the desk of the FDA director. They were not finalized at the end of the Obama administration. Since then, the Trump administration has refused to act on them. This represents a grave failure. I'm honored to be here and to be a small part of the efforts of these brave protesters who have been out here for several days and nights.
What's your connection to all of this?
Well, as an autistic adult, I'm somebody who has the same diagnosis as many of the people in the Judge Rotenberg Center. For 10 years, I ran the Autistic Self-Advocacy Network. I still serve on ASAN's board. I'm a very big believer in the importance of autistic people having our voices heard in public policy. And I also know that there is no difference except having had the good fortune to have been born to a family that would never consider such measures between me and the people in the Judge Rotenberg Center. Many of them have the same diagnosis that I do. Many of them even present similarly as I do when they are not being tortured within the JRC. I have met people who are former JRC residents who have talked about their experiences. The Judge Rotenberg Center would have you believe that their torture is applied only on the most severe cases. Well, first and foremost, torture is wrong for everyone, regardless of severity of disability.
I was born too late to participate in the civil rights movement, and I always felt guilty about that as a black woman. And the rights, the few little rights that I enjoyed were on the backs of my ancestors and folks whom I have sat at the feet of. And so I was always guilty that I was born too late to take part in a critical movement. So when I found ADAPT, I found home, because not only were we people with disabilities, there were other black folks and people of color, and there were some LGBT folks, because I'm also a lesbian, so there were people like me in ADAPT. I'm autistic, so this stuff has special meaning to me, because a lot of the folks at Judge Rotenberg Center are autistic folks. And I read about what goes on at Judge Rotenberg, the setup for when you get shocked, how you get shocked, what they wear, that it's remote controlled, all that just, it resonated with me. It hit me. It almost triggered me.
18-year-old Andre McCollins is led into a room wearing shackles. The Judge Rotenberg Center says it followed his attack on a staff member on the way to school.
Andre, take your jacket off, please. Andre, in the wrong directions to take your jacket off. Take your jacket off, please.
Andre fails to respond to the instruction. Then, this. He's given a 2-second electric shock. Andre is then strapped face down onto a board, and over the next 7 hours, he's given 31 more shocks. He spent the next month in hospital. Andre's mother, Cheryl, says the experience changed her son.
There's just no words to describe what they did to him.
A significant number of the people at Judge Rotenberg Center, most of them are people of color. Most of them, once again, sent far away from home to be raised like that, to be shocked into submission, to live their lives, afraid of when the next jolt of pain is going to hit them and why is this happening. and you're doing this to me because I'm being myself. You know, I'm autistic, I stem, I flap, you know, I rock, you know, I do, you know, all of those.
During this presentation, you will see Dr. Von Hein explaining the GED to parents during an interview session.
I was part of the team that developed the GED device, which is a contingent skin shock device. Most of the people that come to our program exhibit severe behavior disorders. That's the reason they are referred. It eliminates the need for removal out of their environment. If they're in the classroom, there's no need to take them out of the classroom. The stimulus, the 2-second stimulus is given, and that's generally the end of it. So getting into the actual use of the device, all the behaviors that we wish to treat, both to increase some of the behaviors we're trying to strengthen, as well as behaviors trying to decrease or decelerate. For most individuals here, that will include self-abusive or health dangerous behaviors, as well as aggressive behaviors. The recording sheet will list, under, say, health dangerous behaviors, topographies that the person is likely to exhibit, and the consequence of that behavior. Now, the GED device that the individual will be wearing, this is the device itself that has a beeper inside. This is a 12-volt rechargeable battery. Now, the individual generally wears this backpack or a fanny pack, depending on how many they are wearing at one time. So we do like to start generally with at least 3 devices on the individual. What it also does is make it less predictable where the stimulation is going to occur. It might be your leg, it might be your arm, or even the torso is used sometime. So the surprise element helps. The other type of electrode that we have has 2 buttons, and the buttons will be separated by up to 6 inches. And also to stimulate a little more tissue, it's a little more effective, a little more aversive. Now, getting back to the recording sheet, if the staff in the room see a behavior that they think is targeted for a GED, they then would pick up the remote transmitter. This itself is the transmitter. So if they witness that the behavior, they confirm behavior on the recording sheet, they then confirm the remote with that staff member. They will then pick up the device and press the button.
In this case, they're trying to make people with, of all ages, people with developmental disabilities and autistic people and various types of neurodivergences act neurotypical, because people with neurodivergent behaviors often make neurotypical people uncomfortable. So to give an example, and I'm speaking here as someone who is autistic.
You're autistic?
I am. Yeah. So to give an example, when... Clapping. Yeah, that's one. So this is my friend Pilgrim, who is autistic. And so when I get excited about something, I do what my husband affectionately refers to as the fangirl dance, right? And that makes some people uncomfortable. If you ever want to see a whole bunch of us all do this at the same time, what will happen is that a police car going by with a siren.
Sensory overload.
Yep, sensory overload, which we've been getting a lot of out here, particularly because the police have been hassling us by going back and forth with the sirens, especially at night when those strobe lights come straight at us.
Rocking
Back and forth.
The intensity and duration is set by our electronics department. The peak output is 30 milliamps, or 30 thousandths of an amp. But on the other hand, it is very effective, and it is uncomfortable. Well, it is in essence a punisher, but even more so, I think it very quickly tells the individual, don't do that again. We do ask the court to approve treatment of self-injurious or health dangerous behaviors, aggressive behaviors, destructive behaviors, as well as non-compliance, which is simple refusal. Not trying to treat difficult waking up, but we don't allow individuals just to stay in bed all day. We do not want to warehouse people. So we may use the GED to treat non-compliance. And also we have a category of behaviors called major disruptive behaviors. which we identify as those behaviors that are antecedents generally to the aggressive or self-injurious behaviors. Yelling and screaming, for example, might be something that will precede them getting agitated to the point where they become aggressive. So we may treat that with GED to prevent them from getting to the next point of hurting themselves or trying to hurt someone else.
This is what's called contingent electric shock. It is shock solely for the purpose of inflicting pain. There is no pretense of a therapeutic value other than the idea that they are hurting children and adults with disabilities in order to force a change of behavior.
So the pain is supposed to be associated with something they find negative.
Right, and if you talk to the Rotenberg Center, they will say, well, we only use it in the most severe instances. That's not true. There's plenty of documentation at the Rotenberg Center using contingent electric shock because a student wouldn't take off their coat in time, because someone didn't make eye contact, because of cursing out an instructor or disobeying instructions. This sort of impression of the Rotenberg Center as using this as a last resort is just false.
Judge Rotenberg Center is most disturbing when you find out that 85% of the children that are in this facility are African American. JRC is using electric shock like they used to use for dogs to train them, which was banned on these autistic, mentally challenged individuals, and call it treatment.
It sounds like there was an old affliction during the days of slavery and Jim Crow. It was an attitude that they...
Yes, and during the slavery times, they did use some type of torture, as besides the beatings with the whips. You cannot train someone, just like during slavery times when they thought that by beating people to train them to do what they want you to do.
Inflicting pain
in order to get an end result of loyalty and obedience. And no human being is to be trained. All humans bleed red blood. All humans, regardless of race, creed, color, and disability or ability, all bleed red blood, all have feelings, all want to the things that are declared that we should have, the pursuit of life, liberty, and happiness under the Constitution. We are not really guaranteed that. But if you are African American, a lower class, or somehow not perfect with all 5 fingers, arms the right length, legs the right length, then you're considered disformed, and that you should not be heard or seen from. That old adage, out of sight, out of mind.
Trauma is not treatment. It's exactly what it says. You know, hashtag stop. I think we've covered up. Stop the shock. That's exactly what we're here to say. I mean, trauma is not treatment. Scaring someone, making someone submissive and just taking every bit of their soul, their life. That's what trauma is. Taking away the life and the soul of someone in the sake of therapy. That's wrong. That's what this says. Trauma is not treatment.
Now, I also hear that most of the people in this institution are African Americans.
That's correct.
Why do you think that is the case?
Because, well, first of all, there's a lack of acceptance of mental illness in African Americans on the part of white people. The intersection of disability and race is a dangerous one for the people who live it. white people tend to be more understanding of our own weaknesses and our own needs and our own needs for accommodation than we are of those same needs in people of other races.
Why is that?
Because we live in a racist society. We live in a society where we are surrounded by structural inequalities. We live in a society where we benefit from privilege and we benefit from being at the top of those power structures, whether we intend it or not. It doesn't mean we're all horrible people, but it does mean that in the same way that a fish doesn't necessarily notice the water that it's swimming in, we are, this is the structure that we're born to. It's the structure that we're raised in. It's not something we choose necessarily, but it's there. And the first step towards dismantling it is noticing that it's there, so that we can begin to question it and interrogate it, and to dismantle places like the JRC, where it is enacted in some of the most horrific fashion.
It's simple. When you're trying to be yourself, when you're being who you are, and someone thinks that they're going to take something that hurts you and change you with it, because they don't think that that's appropriate. I hear my friends talk about the changes that they're trying to do in them and the different types of torture that they do to do that. And, I have to say that it's part of that pain and torture that makes me who I am today, because they weren't gonna break me. And I even remember being young and being told, we're gonna break you. You're not gonna act like that. You're not gonna act like that. And I guess the thing that kind of sticks with me about that is, and something, because the treatment that I had in crippled children's, that institution, isn't the same as the shock, but what it was we don't approve of your behavior. You should act like this instead of who you are. But I can tell you this, it did help make me into wanting to fight this. It's what I wanted to do, because what I know is, why in the world would you mess with the beauty of somebody and try to change them? Who is another human being to say how you should act, who you should be? But can you believe 52 years later, they're still doing crap like that, trying to change somebody? And I want to say something, because if you're going to post this, it's going to be on YouTube for the horrible, horrible, horrible abusers that go to work every day and think that they should change people like me. Fuck yourselves. Seriously, I don't know what else to say. I hate these kind of interviews because you're waiting for the right words to say, and my CP brain just goes and explodes. But the truth is, you hate fuckers that want to change you because you're just fine the way you are.
What's your name?
Ziomara. Ziomara, you're beautiful.
Yeah.
You gotta smile for her.
I like
Yeah.
She's showing you her shoes.
Ooh.
Can you see the shoes? And I realized it's from all the signing videos we did with her that had the written word.
Yeah.
So her vocabulary is quite large despite not speaking.
Yeah.
But she recognizes the sign.
Interpret. What does her say?
Oh, my so she actually knows. RESIST. Resist. This was an adapter. This was proceeds went to adapt.
I love it.
Yes, yes.
I love
my resist shirt.
I can learn sign.
I taught her to sign resist. That was one of her words. So she could sign her name. She could spell out her name. And I was like, okay, what's the next one?